Doctors, what's the dumbest thing patients have lied about? A common one is about their smoking. Smoking is an enormous risk factor for fracture non-union, meaning a fracture that doesn't heal. When I walk into a non-union patient's exam room and it smells like a cigar den, I know they smoke. But they'll tell me they don't right to my face. Before signing them up for revision surgery, I'll commonly order a urine test for nicotine metabolites. Often it'll turn out positive and suddenly surprised Pikachu face. Edit lots of folks below rightfully commenting on how indicating you're a smoker increases your insurance premiums. This is true. However, the cost of complications after a surgical procedure would dwarf a lifetime of increased premium costs. I would still recommend that smokers be straight with their surgeons so they don't rush into surgeries that end poorly. Story 2. Penis modification. The case was an elective above-the-waist surgery, and he denied piercings. However, when the nurse went to place the Foley, she found the patient had modified his penis and it was split/bifurcated with multiple piercings to look like a cobra. The nurse did not know how to insert the Foley. The piercings also limited the ability to use electrocautery. In addition, he also embedded a metal implant inside his testicle that looked infected with a possible abscess. Cancelled case, called urology consult for infection/abscess evaluation. Story 3. Had a guy in the ICU who had come in with a perforated bowel and had to have it fixed. He was a misogynistic racist fuck and would rant at any woman or foreigner who came into his room, aka all the doctors seeing him. But, during his being a fucking ass, he would throw in there how he was injured. Turns out, him and his wife were smoking crack, which he said was a hobby of theirs. He then had her fuck him with a pool cue and perf his colon. She had been at work all day and came in and said something about how weird it was that he got this injury from a fall. I was like, he has told everyone the truth while going on racist and sexist rants. Was super weird. Story 4. It's not so much a patient lie as it is me being dumb, inexperienced and uncomfortable asking necessary questions. I had a hypothetical patient during residency that was a very manly veteran and I was admitting him for rectal bleeding. He was in the age where it more than likely colon cancer, so I didn't think it was necessary to ask a sexual history. Folks at this particular establishment were known to at times be homophobic and I had been yelled at by patients previously for asking, do you have sex with men, women or both? It ate away at my conscience, though, so I went back and absurdly nervously and asked him. He answered, son, I'm as gay as a rainbow. I've been at the bathhouse for the last couple of nights but I wasn't sure how it would go over to admit it. That's when the bleeding started. It was a very important lesson for me. Story 5. Got a few. 1. Patient says to me I was outside gardening while naked and I slipped. That's how a massive potato ended up in my ass. Anybody want fries while he is waiting to get it removed? 2. How did you get that stab wound in your abdomen? I put a knife on the kitchen counter and forgot it was there. Then I walked into it. 3. Me, have you had anything to eat or drink today prior to your surgery? Patient, no, they said with a half-eaten candy bar in front of them. Me, are you sure? Because if you have, you could vomit upon going to sleep and it could enter your lungs, causing you to die. Patient, then yes I have, I had half that candy bar. 4. This one guy repeatedly used to come in saying he hadn't shit in 7 days. This would usually necessitate a rectal examination with a finger. That's why he kept saying it. Patient used to come in every time the new doctors rotated in, who wouldn't be wise to his tricks. 5. One guy came in feigning unconsciousness. Did not respond to even the most painful of stimuli and, some of these were pretty painful. Did not budge. We were talking amongst ourselves about intubating him. He then opened his eyes and said they did that last time, I didn't like it. Story 6. Not considering the psychiatric and the boring answers, like people who just swear with all their heart that they are taking their medications when they clearly aren't, which is the vast majority. There's not much, really. Only one really unique comes to mind. It was a patient that was a really kind old man who always would talk a lot with us, telling stories, praising the beauty of everyone in a tender and respectable way, saying how really grateful for our work he was and so on. Said old man would always appear with really high blood pressure values, even though he would swear that he always used his medication correctly. And after we did so many changes with his medication in many different ways, it's only natural to think that there's some problem with how he's taking them, if he was doing it at all. However, one day, after noticing that he would always go to the bathroom before even reaching out to the receptionist, someone discovered he would always eat a load of pure salt before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later we also, obviously, discovered that he indeed would not take his medications correctly as well, in order to obtain this result again and again. Turns out he suffered a lot from loneliness, and he was an old man that didn't have much contact with his family anymore, but mostly because his family didn't reach out to him almost at any given time, even though everyone lived close by. And in his desperation, Sustaining dangerous high blood pressure was the best way that he had to obtain human contact within the emergency every week. This was the most odd one, but it's really common in general among elderly patients to appear lying about their symptoms, only trying to gather some attention and a private minute to speak about anything else. Most of the time they book an appointment only to talk about recent trivialities, which makes them clearly better, although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness bring to them. Around my patients, at least, it's common for many to cry as they leave. Loneliness is a hell of both a simple and complex problem, and one that no one should be bound to live with. Story 7. One of my favorite things I wrote my first year out of medical school. Please note patient has stated multiple times that he wants to leave and would leave AMA, which means against medical advice. He asked multiple times whether he could eat and stating he is hungry. Explained to patient that we would like to start a full liquid diet first and if he tolerated it well, would transition to regular foods. However, PT ordered Chinese food delivery instead. Then, patient was complaining of a headache. Was given Tylenol for the headache. Patient stated that this did not help him. His sister at bedside went to the nearby pharmacy and bought goody powder aka aspirin. Sister did ask whether she could give him goody powder. She was told not to give patient the goody powder. She supposedly did not. For context, the patient had a catastrophic GI bleed from taking too much aspirin. Story 8. One dude lied about being paralyzed after a lumbar puncture. Get a call from nurse, patient says he can't move legs following a lumbar puncture. I called the team that did the procedure and they assured me there was no indication of this sort of injury happening during the procedure but agreed with my plan to get an urgent MRI. I go to examine him and nurse says she thinks he moved one of his feet. Next thing I know he says he can actually move his legs again but they are feeling weird. Then this weird feeling turns into intense pain and he asks for intravenous narcotics. I tell him no because this story makes no sense. By God it was a miracle I tell you when this man walked himself right out of the hospital after I refused the fourth narcotics. Also, the MRI was normal. Story 9. My little brother was a nurse for about a decade. He has said many times that people stick anything up their butts. From light bulbs to hairbrushes to a golf shoe. And at first it's hilarious. Then after a year or so it's not funny because you've seen way too many distended buttholes. Then after a decade or so it starts to get funny again because you think you've seen everything and then one day a 45-year-old man is driven to the hospital by his wife and he has a golf shoe up his ass and he told his wife that he and the boys were golfing and he slipped in the locker room and it got rammed up there completely disregarding the fact that the part of the shoe that is inside him is covered in Vaseline. Story 10. Nurse here. The absolute dumbest thing patients have said. And to be fair this was the patient's parents since I was in petty but still dumb AF and caused no end of grief trying to unspin it. I was rooming patients and I went to the full lobby and called the next one in by last name. They stand up and mom and dad bring the little girl back. I'm rooming them, take the vitals, review purpose of visit, make some adjustments to the chart, update their pharmacy and allergies and go out and let the pediatrician know they are ready. The pediatrician goes into the room and come out like 3 minutes later and says, "That's not my patient, where is my patient?" I'm like, WTF? I go in and ask the parents and no in fact they were not the patient. I'm like, why did you say you were someone you were not? They simply said they didn't want to wait so they just came back. We had to completely unspin all the changes to the chart and had to get legal involved to make sure there were no HIPAA violations, which fortunately, there weren't. I'm fascinated that people can collectively think, yeah, let's do this, no one will know. Like, how does that even play out in their minds? Story 11. Resident doctor here. This happened during my psychiatry rotation in medical school. I wouldn't say it was a dumb lie since the patient was mentally ill but I would say it was the most memorable lie. There was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. Story 12. First baby, never pregnant before. New OB appointment, we collect everything and do exam. I put a speculum in and I see her cervix. After her partner left the room, I ask her again, and she says she doesn't want her new partner know that she's a single mom. Not dumb, but just very obvious on an exam that she has definitely given birth before. I left a note on her chart to not mention prior pregnancy in front of her new partner. Another on my gen surgery rotation as a medical student, removing objects from rectums due to unfortunate falls. Story 13. Dad is a physician and has a million funny stories. He told me this one from a few decades ago. Had a patient come into the ER with a towel over his groin, covered in blood. Claimed he was cutting vegetables in his kitchen and the knife slipped. Dad takes a look and the guy is butchered down there. Had to call a urologist in the middle of the night to consult. Guy eventually confesses to trying to give himself a circumcision because he didn't want to pay the $200 it would have cost. Urologist was able to help save him, but it cost a hell of a lot more than $200 for emergency penis surgery. Story 14. I had a patient that lied about having a job. I asked because he had hepatitis A and I wanted to know if he needed a medical leave. He denied it even though I asked twice. Next day, he came back because he was going to get fired if he didn't provide a doctor's note. Here is some clarification. 1. I'm in Venezuela, he wouldn't have had to pay anything for that visit regardless of his employment status. 2. He isn't an undocumented immigrant. It's a very small community where everyone knows each other and he has lived there his whole life and many of his relatives have also been my patients. Also, undocumented immigrants aren't really a thing here. Some tourists may come without having the proper paperwork, but this isn't really a desirable place for immigrants looking for work. 3. He said that he didn't have a job, he didn't say that he didn't need a medical. 4. I asked what he did for work in his second visit, but I can't remember what he told me. 5. There really isn't a whole lot of stigma around HEPA around here, even if you work handling food. People just sort of feel sorry for the person and tell them to not eat yellow things. So, I don't think it was because he was afraid of being shamed/reprimanded because of it, but I could be wrong. 6. I'm obligated to report viral hepatitis cases to the health ministry, so they make sure there isn't an outbreak, and I told him this. So, he knew that it was going to be reported either way.